folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Today
Bob.
we're going to talk about, can my knee cartilage tear heal? And we're saying we're saying your. Can your knee cartilage heal?
Right.
Tear.
Ours can, but theirs can't.
No, we'll go into that.
Okay, very good.
So when you have a tear in your cartilage, it could be from a sporting event, or unfortunately, as you get older, it can just happen with age.
Yeah.
Oh joy, Brad. Yeah. One more thing to look forward
but
to.
I think it often there's a twisting or some kind of stress on it that maybe, but not always.
Not always. My wife's a good example. 3 years ago, she all of a sudden had extreme pain in her knee.
Yeah.
She was on crutches. And it was a cartilage tear. Or a piece of...
Yeah, but your wife rollerbladed from Twin Cities to Duluth or something like that.
There's no stress on your knee when you're rollerblading.
Big the difference. Anyways, we're talking about cartilage. So, but we're really referring to the meniscus cartilage versus the cartilage that's part of the bone.
Yeah. Yes. Mm-hmm. And you want to show that, Brad?
Sure. Maybe? So, if we're looking at the knee joint here, this is the patella. With the tendon, and we're going to pull that off so you can look inside the knee. You'll see this blue area is the ACL, that's the ligament. We're looking at this. It's probably hard to see because it's kind of white on white.
Is that supposed to be a tear, Brad?
I believe so. We drew that in there. That's a tear in the cartilage.
The cartilage, can it heal? I'm going to say as a general rule, it does not heal well.
Yeah, it's a very slow healing process
if it's going to heal
if
at
it
all.
does, yeah.
And if you're looking again at the cartilage, it tends to heal better on the outside of the cartilage because there's a little more circulation there.
Yeah, if there's a little more blood flow, that's where it is.
The other thing that can affect how well it heals is the type of tear. The worst type of tear, and that's what Brad was alluding to, is the tear that gets folded up.
Right.
And because you think about it, there's not that much space in the knee. And if your cartilage gets rolled up a little bit, it's going to block the knee from moving.
Right.
It's going to get locked, or you're going to feel pain whenever you move the knee.
Because it should be smooth, then you get that fold, creates a bump. I've had a lot of people, they talk about it locking up, and I don't spend a lot of time with them typically. I say, go get it looked at, see what's going on.
Because quite often you're going to be headed for surgery if that's the case, unless it works its way out.
Right.
So that's probably one of the few times you're going to require surgery for cartilage, unless it's so bad that you need a knee replacement. So,
right. I think if it is just cartilage, sometimes they can go in orthoscopically, clean it out, just to remove that bump. Right.
Yeah, exactly.
Yeah. And, maybe they're doing less of that too. I'm not sure.
No, if it's locking up, they're doing it. The question is, can my knee cartilage tear heal? Question really should be, does your knee hurt? Because if it doesn't really hurt, you can function without the knee cartilage being, totally intact.
Sure.
It can be a tear. So no worries. Like we alluded to, does the knee lock up? Then it's a problem.
Right.
You need to go in. Does your knee lack motion? Same problem. If it's blocking the motion, you need to go in.
Particularly if you cannot straighten the knee all the way and you're lacking 5 or 10 degrees of full extension, it's going to change the mechanics of the knee, particularly with walking.
Does your knee feel weak? Now, in that instance, you could probably do something. You're going to strengthen the muscles around it. We got plenty of videos on that, on how to strengthen the knee. Just check it out.
Yeah.
Well, we might as well talk about it. If you go to our program section of Bob and Brad.
That's our website.
Program, go to the website, and you'll find in that section we have a whole bunch of programs on specific topics.
Right.
One topic is on knee pain.
Right.
And this video is part of that. And as a part of each video, what do we include, Ben?
Right. Well, you go down, like on that one, you'd find the title that says Strengthening the Knee. Go to there. We have actually a PDF printout that prints out the review of the whole video, the exercises, and it works wonderful. You don't have to go back and look at the video every time you try to remember the exercise. There's absolutely no charge, no cost, not even an email. It's just a free program that's a gift.
Our gift to you.
Right.
So going on with this now, Brad.
Oh, yeah.
Again, can my knee cartilage tear heal? We decided most cases not. But one of the questions, if you're having a lot of pain, we would recommend trying a crutch or a walker or a cane for a while and see if you can get it to calm down. Maybe
Sure.
it's just swollen up. So give it a go. That's what my wife did. She was on crutches for quite a while, and then she went to walking sticks. That was 3 years ago. She was crying at the time. She thought, I'm going to get a knee replacement. She's running. She ran this morning.
She did.
Yep, she ran around the lake. Finally, does the knee swell up? Same thing. If it's swelling up, take some of the pressure off of it for a while.
Right.
And see how it handles. In summary, it really may not matter if there's a tear in your knee cartilage. The question is how you can handle it, whether you can handle it or not, and calm it down.
Right.
and
What
if
the
it's gonna be-
symptoms are.
Right. Right. So unfortunately, again, it can be a process of aging. And Brad, I know that all too well. Add on a few years to you, and things start to break down.
Every decade is another step, another
Yep.
chapter in the
Another
human body.
challenge. Thanks for watching.